Hello, in this tutorial I will explain how to import a 2D plane for the surgery in our 3D standard planing. We have to perform it previously in a 2D software the surgical treatment objective. So we can go from this button, standard planing, we can go here in the second step of the list, Arnet Classic Wizard. Here I just have to confirm the orientation of the patients, and you can see in the layout on my left I have different steps to do it. So if I confirm the orientation of my patients, I just have to import the second step, the 2D file. I click on Load 2D Tracing, and I go directly to the file from the records of my patients in which I've saved my treatment. I click OK. And now in the next window I have just to select which file is the one with the best treatment I have performed in 2D. So I just click on OK, and the software will import all the surgical movement in the sagittal view. So right now I have to go step by step with any bone segment. We start from the mandible. So here I have the maxillary in original position and the mandible in final position according to my 2D planning. So right now I can do some movement, not just anterior posterior, but also in the frontal view. I can automatically place this in the midline. I can use the second option for the counting, for the canine, and set the jaw. I can set the jaw automatically, or I can click on freehand, turn my patients, and start with the arrow moving the jaw of my patients. Now I can go to the next step, maxillary positioning. The same, I can see the maxillary in the final position, and I can correct some part of this movement in the frontal view. I can align to midline, canting again, and jaw. Also, I have the option to do the occlusal adjustment from here or from the last step. The same for the chin. If I have moved the chin in my 2D file, I would see here some movement. Then I can move a little bit my chin segment from the frontal view to the left to the right. And the last part is about the posterior part of mandible. Last step is just again the standard planing. In the order I want to correct some movement that maybe in the 2D was not properly. So I can again take my bimaxillary complex, see the patient from the front, and then maybe I can center a little bit in the frontal view my midline, like this. And that's all. In the second Arnet Classic Wizard is exactly the same, but we start planning the maxilla first.